Hi, I'm Dr. Bruce Marshall of the Marshall Clinic in Vancouver. This week's topic is the process of moving from losing a tooth towards having a replacement tooth that's supported by an implant. So unfortunately, sometimes people will lose teeth, most often due to decay or sometimes cracks in the teeth that lead to vertical fractures and or periodontal problems that can cause bone loss around teeth and therefore no longer able to be supported and maintained. So the process works roughly like this. So the missing tooth will come out. If there's viable bone around the root of the tooth, often we'll recommend something that's called a socket preservation procedure, which is to fill you remove the tooth, clean the space where the tooth was out, and then place in a bone substitute. The bone substitute and then a little membrane over top will help maintain the volume of bone so that there's no loss of bone, and you can place an implant easily and maintain the correct gum architecture and morphology. So tooth comes out, bone substitute goes in, and typically a membrane over top of that. Usually we'll wait at least 3 months for the bone to grow into the space and replace the bone substitute, thereby forming a proper substrate for the implant to go into. During that process, people may or may not choose to have a provisional or temporary replacement tooth in the space where the tooth is missing, depending on aesthetics and functional concerns. So those can range anywhere from something that's like we call a flipper, which is like basically a retainer with a tooth on it, to something that's bonded to adjacent teeth. And those are the two most common types of doing that. So once you're in a healing phase for 3 months, once the end of the 3 months is up, we'll have you come back to the office and we check the site to make sure that there's gum tissue looks healthy. We take an x-ray to ensure there's enough bone, and then we plan for what size of implant will go in. Then we'll see you at another phase to place the implant. That procedure is really very easy, usually far easier than taking the tooth out, easily done under local anesthetic in the office. Usually we'll lift the gum out of the way, place the implant into the healed site, and then bring the tissue back up against the implant and let it heal. Most commonly the healing phase for that is only 6 weeks. Then we're ready to build a tooth on top of that. So the next step then is, once the healing's occurred and the bone has grown right up around the implant, so you have a solid structure to attach a tooth to, you come in and we will scan or take an impression of the site, and from that we'll build a tooth that will bolt onto the top of the implant. So the healing cap comes off, something's bolted to the top of the tooth, an impression or a scan is made, then that's all removed and the healing cap's put back on, and you go away for a period of 2 weeks. You come back and then we have the new tooth ready for you. We bolt it on, make sure it fits properly, the color's great, the shape's good, and then we seal it up or cement it depending on the option, but typically seal it up and away you go. And we expect 10-year survival rates in the high 90s, so 98% give or take. And of course you got to keep it clean around there, brushing and flossing carefully to prevent any kind of gum irritation from happening, but otherwise it's a very predictable procedure. So thanks for watching. For more, subscribe, and next week's topic I'm going to talk about cracks in teeth and how we manage those things, and then we'll go on to talk about materials to restore teeth. Thanks for watching.